Hey everyone, and welcome. Today we're going to dive into something that, a lot of parents and caregivers might find surprisingly relevant, some of the lesser-known skin conditions in kids.
If you have, you are definitely not alone. Sometimes that weird rash you see isn't just the usual stuff like eczema or a simple bug bite.
So that's what we're doing today. We're going to explore 5 skin conditions in kids that can be really easy to miss or mistake for something else entirely. Let's jump right in. All right, first up, we're calling this section From Pets with Love. And yeah, there's a reason for that. Turns out our furry best friends can sometimes share a little more than just cuddles.
Okay, so our first one is called tinea facialis. You've probably heard of it by its more common name, facial ringworm. And here's the kicker. A lot of the time, kids get this from their pets, their cats and dogs.
And take a look at this picture. It's a perfect example. You see that classic ring-shaped rash right on the cheek? That's the telltale sign. And just to be clear, despite the name ringworm, it has nothing to do with worms. It's a fungus.
Now, a close cousin to that is tinea capitis. It's basically the same kind of fungal infection, but this one shows up on the scalp. People call it scalp ringworm, and it can cause these scaly patches and, even some hair loss.
And you can really see what I'm talking about here. This patch of scaly skin with the broken hairs, that is so typical of tinea capitis. And again, just like the facial kind, this is often a little gift from a furry friend.
Okay, let's move on from our pets for a bit. Our next section is called Keeping It in the Family. Because, some of these things can get passed around between people in ways you might not expect. So, for example, let's talk about pediatric nail fungus. It's exactly what it sounds like, a fungal infection in the nail. And while you see it more in adults, it can definitely happen in kids. And get this, sometimes it's linked to a parent having athlete's foot, which is caused by a similar kind of fungus.
Just look at what it can do to a fingernail. See how it looks all chalky, kind of white and thickened up? That's a classic sign that a fungus has moved in.
Okay, next up is something that's a real shapeshifter depending on age, scabies. And this is what's so fascinating. In adults, scabies usually avoids the palms of the hands, the soles of the feet, the face, and the scalp. But in babies, that's exactly where you'll often find it.
So the big takeaway here is that it's the same mite infestation, but it just looks totally different in infants. And knowing that difference is absolutely crucial for catching it early.
And this picture just drives that point home. See those little red bumps and the tiny burrows right there on the baby's palm? That is textbook infantile scabies, but you'd almost never see it there on an adult. All right, for our last section, we're calling it Not What It Looks Like. And this is all about the masters of disguise in the skin world, conditions that look like one thing but are actually something else. First up in this category is something called myrmecia. Now, it's a type of wart caused by HPV, but it doesn't look like the warts you're probably thinking of. Instead, it often pops up as a single, tender little bump that you'd swear was a blister.
Let's take a closer look. See that bump on the toe? It's firm. It looks like a blister, right? You can totally see how you'd mistake it for something else. But nope, that's actually a myrmecia wart.
And our last one for today is erythrasma. Now listen closely, this is a bacterial infection, not fungal. And it causes these reddish-brown patches, especially in skin folds, like under the arms.
And here's the crucial part. Because of where it is and what it looks like, erythrasma gets misdiagnosed as a fungal infection all the time. Why? Well, because they can be almost impossible to tell apart just by looking.
And this comparison says it all. On the left, that's erythrasma. On the right, that's a fungal infection. See how similar they look? It's pretty wild. And you can see why getting the right diagnosis is so important, because you would treat them completely differently.
Wow, okay, we've covered a lot. So let's just quickly wrap this up with the key takeaways.
So, just a quick recap of what to keep an eye out for. You've got those ring-shaped rashes, especially after playing with a pet. Weird nail changes, especially if someone at home has athlete's foot. For the little ones, for infants, rashes on their palms and soles are a big one to watch. Then there are those single, tender blisters that just seem to stick around. And finally, those reddish patches and skin folds that won't clear up.
And this really brings us to the most important point of all. The goal here is just to make you aware of these things. But if you're ever in doubt, please, always go see a doctor. Trying to diagnose skin stuff on your own is super tricky, and you can easily end up using the wrong treatment.
So there you have it, a quick look at 5 pediatric skin conditions that might not be on your radar.
It really makes you wonder, right? What else can we learn just by looking a little bit closer? Hope you found this useful. Thanks so much for joining me.